with prostate cancer can experience a multitude of treatment side effects and impairments. So how do you screen and prioritize the potential laundry list of impairments that your patient may face? Hi, my name is Elise and I'm the OncoPT, and I have helped so many of our OncoPT clients assess and start treating their patients with prostate cancer without the overwhelm. And today, I'm going to show you how as well. The first impairment to screen your patient with prostate cancer for is depression. Patients with prostate cancer often experience emotional challenges due to the diagnosis and treatment process. Studies show us that depression rates are higher in our oncology patients, including our patients with prostate cancer, compared to the general population. Depression can negatively affect your patient's quality of life as well as adherence to treatment plans, and that is a big deal in this patient population. Early detection allows for timely intervention and improved health outcomes for our patients. Untreated depression can lead to worsening mental health, which is particularly problematic because some treatments that are commonly prescribed to treat prostate cancer can actually increase a person's risk of developing major depressive disorder. All this to underline how much of a big deal this is for our prostate cancer patient population. Understanding the prevalence of depression helps you anticipate and proactively screen your patient with prostate cancer for depression. Common screening tools for depression in the prostate cancer patient population include the Patient Health Questionnaire 9, the Beck Depression Inventory, the Hospital Anxiety and Depression Scale, the Center for Epidemiological Studies Depression Scale, and the Zung Self-Rating Depression Scale. You should also ask open-ended questions about mood changes, feelings of sadness, and loss of interest in daily activities during your routine follow-up visits with your patients. Moving on to the next impairment, which is bone density issues such as osteoporosis. Androgen deprivation therapy, a common treatment for prostate cancer, can lead to bone loss and osteopenia and osteoporosis. Understanding this connection is crucial for proactive management. If your patient is being treated with androgen deprivation or has been treated with androgen deprivation therapy, this needs to be on your radar. Regular imaging, such as DEXA scans and bone scans, can monitor for bone loss. And this early detection of bone loss means better implementation of preventative measures and timely interventions for your patient. Now, you are not necessarily the clinician who is ordering the DEXA scans, the bone scans, but you do need to be aware of this because you need to be the one reviewing any results from those bone scans, as well as encouraging your patients to keep up with their regular bone scans so we can monitor for any changes in bone density. Additionally, you can identify potential risk factors for osteopenia and osteoporosis in your patient with prostate cancer. I would encourage you to do this by assessing your patient's history, including have they had any prior fractures? Do they have a family history of known bone density issues, osteopenia, osteoporosis, for example? And then also assess various lifestyle factors that your patient may have. This can include alcohol consumption, smoking history, current smoking, whatever that is, as well as nutritional status, exercise status, and so much more. Now, before I move on to the next tip, if you want to know more about how to start treating patients with cancer, then head to the free guide linked in my description box below, where we will dive deeper into how to start treating patients with cancer, including prostate cancer. This quick guide will walk you through the tips and the steps that you need to implement in order to start treating your next patient with cancer who walks through your door. Again, make sure you grab your free guide by clicking the link in my description box below. Now, with that out of the way, let's move on to the next impairment that you need to screen your patient with prostate cancer for, which is sexual dysfunction. Erectile dysfunction and libido changes are common side effects of several prostate cancer treatments. Patients can experience anxiety and emotional distress over their sexual dysfunction. So it's really important to screen your patients for this from the get-go. Especially when you're newer to cancer rehab, you may feel apprehensive about asking your patients such vulnerable questions. However, The prevalence of sexual dysfunction and the distress these patients face as a result of that sexual dysfunction needs to outweigh any potential embarrassment that you may feel from asking these questions. More often than not, your patient and their partner will appreciate you asking these questions because it shows that you care and it shows that you're looking out for them. And this is a safe space to talk about this stuff. Your job is to recognize the emotional impact and toll that sexual dysfunction can have on your patients and probably their partners. Now, as a non-pelvic floor physical therapist myself, I'm not asking you to do anything that I wouldn't do, okay? These are things that I talk with my patients about, and what I'll do is, even if I'm not the most appropriate therapist to address these issues with them, I can get them connected to professionals who do have that training, who do have that experience, and would be more than happy to help your patient with these issues. But we won't know until we ask these questions. The APTA Oncology Edge Task Force has some highly recommended tools for you to screen your patients with prostate cancer for sexual dysfunction. And these include the International Index of Erectile Function, Erection Hardness Score, and the Sexual Health Inventory for Men, also known as the International Index of Erectile Function 5. The next impairment to screen your prostate cancer survivor for are balance problems and falls. Your patient with prostate cancer may be at an increased risk of experiencing falls and fractures. Now, we already talked about the impact that androgen deprivation therapy can have on bone density, but it's also important to remember that some prostate cancer treatments can lead to muscle weakness and balance impairments, which kind of all comes together in a recipe for disaster. So here's a few things that you can do to screen your patient with prostate cancer for balance impairments and fall risk. During your evaluation and during your visits with this patient, you need to be observing their gait, their posture, and their stability as they're moving around in your environment. Additionally, APTA Oncology Edge Task Force highly recommends the Fullerton Advanced Balance Scale as well as usual and fast gait speeds. Other recommended tools are the Balance Evaluation Systems Test, the Timed Up and Go, and the 5-time Sit to Stand test. The next impairment to screen your patient for is kind of a cluster. It's kind of a combination of things, and that is aerobic capacity and fatigue. Prostate cancer treatments, including surgery, radiation, chemotherapy, and more, can lead to reduced aerobic capacity and fatigue. Understanding these effects is crucial for tailored rehabilitation to actually help your patient improve. As you know, aerobic fitness supports overall health, enhances endurance, and helps reduce the fatigue that many of our patients with cancer can face. But perhaps most importantly of all is that patients who have better aerobic capacity may actually tolerate their cancer treatments better, meaning they're better able to finish the full prescribed regimen of cancer treatment, giving them the best shot at having no cancer, right? To be cancer-free, which means they may actually have better long-term survival with improved aerobic capacity. Some tools I love to use to screen this, as well as kind of overall mobility with my patients, include the 6-minute walk test and the Timed Up and Go. During your screening, as well as during your daily sessions with your patients, you need to be monitoring their heart rate, their oxygen saturation, their rate of perceived exertion, all that good vital stuff. You need to be monitoring those so that you can assess what is your patient's cardiovascular response to exercise and then making appropriate adjustments to meet their goals. Now, at this part of the video, you may be feeling, okay, I feel a little better about screening and assessing my patients with prostate cancer for various impairments, but what about my patients with other oncologic diagnoses? That's why your next step is to watch this video where I walk you through step-by-step how to improve your evaluations for patients with thyroid cancer. Thank you so much for watching this video, and I can't wait to see you in the next one. Until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.